This is episode 4 of How It Rocked My World. And just to get you up to speed, so I started my period when I was around 13 years old, and over the years it got a lot more heavy and a lot more painful, something that so many young women experience but not a lot of people talk about. And then when I went to my first gynecology appointment at like 18, she just offered me birth control pill, and I didn't want to take it, not because of religious reasons, but just because I didn't want to put something like that into my body. I didn't want the side effects. I just was concerned. I didn't know enough about it to take it, so I just decided to deal with it. And I went on my way. That was at 18 years old. Then at 25, I had this really sharp pain on one of my ovaries. I found out I had a big old cyst on it. I needed surgery, and that I probably have something called endometriosis. So I went to have surgery. This was with a different doctor. I was excited because I finally got an answer to my problems, like an explanation of what was going on. And she told me that I should feel better after the surgery, but I really need to get back on birth control. I said, get back on birth control. I was never on birth control in the first place, but she again was trying to get me to get on birth control, since that's like the mainstream treatment across the board for this disease. Again, I thought about it. I took a sample she took with me, but again, I declined. Again, not for moral reasons, just because it just made me nervous. I didn't want to take it. So I had the surgery, stayed off birth control, and the pain never got better. It stayed the same, but the disease did get a little bit worse. I found out within 3 months. And I went back to see her. I had an even bigger cyst at this point, and she told me 3 months after my first surgery that I needed another surgery. So that's kind of where I left off with y'all last time. So my first surgery was in June, and ironically I discovered the Creighton model kind of right around that time of my first surgery. I had never heard of anything like this. It seemed crazy even to me. It was kind of like exactly what I needed, even though I didn't know what it was yet, because again, I didn't think doctors that don't prescribe birth control exist, and so I kind of started hearing about it for the first time from my mom, who had a friend who was a Creighton practitioner. Creighton practitioner are the people who they go get trained on how to read your chart and kind of teach you the method of collecting the data from your body and making sure it all looks right and accurate for your doctor to read on the chart. So this is just a copy. I started charting just to kind of start doing it. Like I said, I had just had surgery. I had no reason to believe I needed another surgery. First date, it looks like the end of July in 2011. This was before I found out that the disease had gotten a bit worse. But luckily I had started charting, so I had all that information that I was just starting to gather for a couple of months. 3 months after surgery, a couple months after I started charting, is when I found out I needed the other surgery, and I scheduled it with this woman who did the first surgery. So I had a little bit of time in between that to really start thinking about it, and I think a lot of us take our fertility for granted. I certainly did at the beginning. Even when I found out I had the disease and I knew that infertility was one of the symptoms, I was really blissfully ignorant about it. I remember telling people, like, I'm probably not gonna have trouble getting pregnant. Like, how I thought I knew that, I don't know. Anyway, just the naivety of being young. But I just kind of assumed I would be fine. And however, I started to understand there how important my fertility was, and how I really needed to understand how precious this gift is. I just started questioning, like, how much does my doctor really value this in me? I know that she cared a lot about me and a lot about this disease, and she really did want to make me better. But I just started to look out there for other philosophies, for other ways of healing this type of disease. Once I heard about Creighton, my mom was kind of nagging me about it, so I put it off for a little while because it was like one of those things your mom tells you to do, you just don't want to do it. But eventually, like I said, I did start charting, and I saw my Creighton practitioner. But I really had planned on sticking with my original doctor for the surgery. It wasn't until my dad called me up and said, This guy named Dr. Thomas Hilgers, who created this stuff, was on the radio. I turned him on just to kind of hear his philosophy and his inspiration and his mindset towards this treatment. And that's where I was really blown away, because again, I had many conversations with my first doctor about this, but the conversations didn't last that long. It didn't have very far to go. It was just the birth control takes away your symptoms and preserves your fertility until you're ready to get pregnant. The surgery might not be able to take care of all the endometriosis that was there. That was it. And this guy I listened to talk on the radio, and he has this whole like research that like picked up where basically his mainstream gynecology education stopped, and he picked it up, and over 30-40 years and still to this day continued to research this whole disease, this whole woman's body, the fertility, continued to do that. And he said that, you know, birth control is not treating these diseases. We don't prescribe birth control, which was perfect because I obviously didn't want to take the birth control. And I'm like, what in the world? Like, this is so strange to hear this, but he talked about treating the woman as a whole person and like really appreciating her fertility as a gift, as something that is special and unique. And it was just this whole different appreciation for me as a person, as a woman. Like, that made me feel empowered. That made me feel special. That considered me and the dignity that I have and deserve like way more than any other person or doctor I even thought existed. And so it was a few minutes on the radio, and I was like, it wasn't just the promises, it was a difference in philosophy. I was like, this guy understands how I value my fertility. He really gets it. Not that she doesn't appreciate it, but she doesn't get it like he does. And I thought, I cannot go forward with this doctor, this first doctor. Like, I need to get me some of this guy. And whatever he's selling, like, I am buying. It was so genuine, so authentic, so for me and like who I am, so selfless somehow in a way. Like, how I can expect to get a doctor so selfless and like just really interested in me as a person. It was really special. And so that's really when I made the decision that I need to cancel. I need to not only try to cancel this surgery, but try to see if I can even get in with this new doctor before I cancel my surgery. And time was running out, y'all, but luckily, like a miracle. So I did my research, and so Dr. Thomas Hilgers, who started this whole thing, there are several, and they're growing, naprotechnology doctors that he trains with his method, his philosophy. Like, they go take a year fellowship with him after they graduate, you know, and or become OBGYNs and everything. This is extra that they go and train under him. They have those doctors all throughout the United States and all throughout the world, but they didn't have any in Louisiana at the time. He's in Omaha, Nebraska. So I found out that I needed to basically just write up a little letter, give a little history explanation about myself, send in my post-op report from that first surgery, and 2 months of charting, which luckily I had already started to do. So I had just over 2 months of charting to send to him. And I want to rewind a little bit to back at that first gynecology appointment that I had, where I went in having experienced so much pain with my cycles, so much heavy bleeding, and just wanting answers, just wanting someone to kind of find out a little bit more about what was going on inside of me. Like, I wanted you to ask questions, and I never got that. I literally just got an offer for a prescription. I sent this into Dr. Hilgers. They called me because I told them about my time crunch. They called me before I received this letter I'm about to share with you. Called me the day of my pre-op for this second surgery and told me that I was able to like go up there. They would accept me as a patient and I could schedule surgery with them. So I went to my pre-op and I canceled my surgery, which was just in the nick of time. And I'm gonna explain to you why in my next video. But I'm gonna close up with this just to read you. This is the letter that I received from Dr. Hilders from many states away. I'm in Louisiana, he's in Nebraska. I've never met the man, never spoken to him in person. I just heard him on the radio. I sent him the information, and this is what he sent back to me. He opened it up saying he received the information I got him, and he said, in reviewing the Creighton model chart, that was the 2 months of charting that I had, the following observations are made. It reveals intermediate limited mucus cycles and tail end brown bleeding. These findings are often associated with hormonal dysfunction, ovulation defects, endometriosis, chronic low-grade endometrial infection, chronic inflammation of the cervix, pelvic adhesions, and/or blockage of the fallopian tubes. This was all without ever speaking to me, not even a doctor's appointment. But this is the kind of information I'm telling y'all that our doctors, our NAPR doctors, can pull from our charts. This was 2 months of charting, and this is why I say, had I been charting when I was 13 years old and just started my period, I could have been diagnosed, or I could have given the doctors a much better idea what was going on within months, instead of 10, 15 years, however long it took. It's just amazing. Birth control can't give you this kind of information. It just can't. He goes on to make me some recommendations. He said you should have a thorough hormone evaluation of your menstrual cycle without medication. He wants to get a baseline, a thyroid system dysfunction panel, and a diagnostic laparoscopy, hysteroscopy, and selective hysterosalpingogram with endometrial culture. Is just a fancy way of saying things they do in surgery to gather some more information. He says, I do realize that you have had a laparoscopy in the past. However, the endometriosis was treated in such a way that it has a high recurrence rate and scar tissue formation. If you look back on one of my previous videos, I talked about, it's called Surgery Done Better, and that talks about all of his research there about the difference adhesion or scar tissue prevention alone. That's what he's talking about. I would not recommend you undergo another surgery locally. It is imperative that a gynecological surgeon use meticulous anti-adhesion techniques in order to preserve your fertility. This is so ironic because in the beginning, she was offering me birth control to literally, she said, preserve my fertility. And this is just, I feel like, offering me so much more than that to literally and actually preserve my fertility. And he goes on to say, I'm very concerned about this more aggressive plan for surgery, because this is what this first doctor told me, that with this next surgery, she was going to be a little more aggressive. To me, this indicates removal of the ovary and possible fallopian tube. This would be detrimental to your fertility. So this is just to give you a little bit of a more personal, like practical idea of a difference between mainstream gynecology and treatment of this specific disease, and what the Creighton model charting and NAPR technology can offer. This is a very real life example of what it could do for me, and I was a very extreme case. I had severe stage 4 endometriosis, which I'm going to get to a little bit next time, but I just want to let you know, you don't have to be stuck with a treatment that gives you these side effects that you don't like, that are harmful to you. And you can have a much better quality of life. I want that for you. So stick around, and I'm gonna tell you a little bit more next. It just gets better from this, I promise. I'll talk to y'all soon. Please subscribe to me on YouTube. I'm also on Facebook and Instagram, and share this with somebody that it might help. And I'll talk to y'all soon. Bye-bye.